Maybe you just got a diagnosis that you have a disc bulge or a disc herniation at the L4-L5 area or the L5-S1 region. If that's the case, you've got lots of questions, you're doing your research, and you're trying to figure out what's true and what's false, because let's face it, there's a lot of myths out there when we're talking about disc bulges and disc herniations. So in today's video, we're going to address 5 myths, and we're going to debunk them and talk about what's true, and hopefully give you some advice that can help you along your journey. Hi, I'm Dr. Daniel Bridge, and I'm a chiropractor in Helena, Montana, and this channel is dedicated to helping you with your spinal health. Myth number 1, all disc bulges in your lower back are painful. Very untrue. In fact, studies show that up to 60% of people with no lower back pain, when they get an MRI, they are going to show a bulging disc. Another study showed that even the size of the disc bulge wasn't necessarily correlated with how much pain or how much symptoms somebody is having. The way I see that in my office, the way it presents, is patients will say, "Hey doc, I don't think the problem's in my back." They're dealing with sciatica, for example. They're having burning pain down the leg, but it starts here and it goes down. They don't have any lower back pain, so they think that their lower back is just fine. That's not necessarily true. You can have a disc bulge, you can have it pressing on that nerve and not have any lower back pain. And you can also have a disc bulge, but if that bulge is in the right place and it's not irritating the nerve, then you're not going to have any symptoms at all. So just because your back doesn't hurt doesn't mean that you don't have a disc bulge. And just because you have a disc bulge doesn't mean that it has to hurt. Myth number 2, if you have a disc bulge, you will need surgery. I would argue that the majority of people with disc bulges don't need surgery. In fact, most disc bulges are going to heal just fine on their own. And there's a certain number that aren't going to. There's this gray area between healing just fine on its own and needing surgery, and that's where chiropractic can really come in. And when you have somebody who works with a lot of discs, they're going to be able to do different tests and different treatments and therapies, and pretty soon we're going to be able to determine if your disc bulge, if your symptomatic case is one that can be resolved without the use of surgery. So there's different exercises, there's spinal decompression that can be very helpful for someone who is dealing with a disc bulge. Now obviously, conservative care doesn't help everybody with disc bulges, and there is a certain number of the population that's not going to improve and they will need surgery. But you always want to start with the least invasive thing and work your way up. Okay, for myth number 3, I'm going to pose it to you in a question. If you have a disc bulge, is the best way to take care of it by doing complete rest or by incorporating some movements and exercises? The answer is you should incorporate movements and exercises. The myth is that you need to completely rest and just let that disc heal. If you do that, especially 2 weeks of bed rest, which is what they used to prescribe in the olden days, the muscles in your lower back, they're going to shrink, they're going to atrophy, they're going to become weak. They're not going to provide you with the support and the stability that your lower back and those discs need. So some gentle walking can be very good for you. There's different yoga poses that can be effective. And there's lots of exercises that you can do that can really reduce the symptoms while dealing with a disc bulge. You can look at some of my previous videos and I go over lots of different stretches and exercises that you can do for a disc bulge. So yes, that's a myth. Complete rest is not necessary when you're dealing with a disc bulge. Myth number 4, all disc bulges require the same type of treatment. That is absolutely not true. When we're looking at a spinal segment, you have a vertebrae, spinal cord, the spinal nerves, and then here's the disc. The disc is like a jelly donut all the way around. You can have discs bulging out into the front, into the sides. Normally it's going to be in here in the back where those nerves come out, but depending on which side of the nerve root it's on, is it just pressing back onto the spinal cord? Is it on both sides? That can really determine what types of exercises or therapies somebody's going to benefit from. When somebody comes into my office to do decompression therapy, some people really respond well on their stomach. Some people prefer laying on their back. When we're doing exercises for the disc bulge, a common one that we do are called press-ups, where my patients lay on their stomach and they either come up onto their elbows, or if they're more advanced, they can come all the way up onto their hands and really arch the back. For many people, that is the directional preference. That's the direction that that person needs to go in order to get that disc to heal. But not everybody. Some people will come up onto their elbows and their pain is just shooting down their legs. It's really bothering them. For some people, we need to go forward. We need to do flexion, where someone sits into a chair and they hunch forward and they create a rounding in their back. And they do that multiple times. For some people, that might be their directional preference. Point being, make sure you're dealing with a doctor who really knows what they're talking about and how they can specifically help disc bulges. Not everybody's the same. People are going to respond better to certain treatments and worse to other treatments. And to be able to have a little bit of flexibility to provide the patient, to provide you with what you need, that's really important. On your own, when you're doing your exercises, keep that in mind. You don't want something that's going to keep the pain going down your leg more. You want it to centralize up towards the back. Same thing with different activities. Your body's going to tell you if it's not a good thing for you. So listen to your body. Finally, we're to myth number 5. All disc bulges are caused by an injury. I guess this one's partially true because you can have micro injuries and micro trauma. But so many people think, I didn't have a car accident, I didn't fall off a ladder, I didn't pick up a big heavy box and feel a pop in my back. So how could I have herniated or bulged a disc? When in reality, posture, a lot of sitting, different things, a lot of repetitive movements over time. If you're bending a lot and you don't have good form, you might not notice something in the moment and the symptoms might not show up till later. So keep that in mind. Just because you didn't have a big dramatic injury doesn't mean that you don't have a herniated disc or a bulging disc, that you couldn't have caused that disc to bulge just from your everyday activities in your life. Thank you so much for watching this video. If you have any questions about disc bulges, L4, L5, or at the L5-S1 level, feel free to ask. If you also have other myths that you're wondering whether they're fact or false, leave a comment in the comment box, and I'll definitely be sure to get to all of those questions. Have a great week.